course is to provide, the purpose of this course is to provide students with a basic understanding of health or medical informatics and its application in nursing and midwifery practice, especially for Ghana. It introduces the definition of data, information, and knowledge, as well as what defines a system and a model. It also places a lot of emphasis on the use of electronic health records for the purpose of defining system implementation and nursing process. We will also be looking at taxonomies, issues of privacy, confidentiality, security, and then ethical use of patient information. Then we will also look at the needed legislation regarding the adoption and utilization of technology in nursing. Subsequently, course objectives. By the end of this course, students should be able to discuss informatics used in nursing and midwifery practice. So we are going to look at the activities nurses perform with regards to the applications of technology in nursing and midwifery. We are also going to look at the historical roots or antecedents of nursing and midwifery informatics, especially as we scrutinize the various theories or authors looking at the evolution of nursing informatics. We will further also deepen our understanding of the genesis of nursing informatics in Ghana. I mean, informatics competencies was introduced into our various nursing training colleges in the year 2015. So this year marks 10 years since the inception of what? I mean, nursing informatics. We're also going to look at the various tools that are applied in information technology. So we are going to look at the various tools that makes the role of nurses in informatics visible. We are also going to look at proficiency in the use of electronic patient records, especially looking at nursing process, nursing care plans. All the activities nurses perform have been fully integrated into electronic health record system. So we are going to look at the impact of what? Electronic health records on nursing process or nursing care plans. And we also look at solutions in information technology by using web and other research tools. There are so available, I mean, online databases that may be at our disposal to provide evidence-based, I mean, support to complement the role of what? Nurses in informatics. We are also going to look at nursing taxonomies and informatics standards in Ghana. So we are going to look at the various languages that are in use as far as nursing terminologies are concerned. We are going to look at the needed nursing terminologies as we try to classify them for the purpose of easy understanding and the way nurses will be able to provide the needed communication among healthcare team members. So we are going to scrutinize that. Then we also look at contemporary issues of today's nursing and midwifery informatics in Ghana. So when we talk about the contemporary issues, we are going to look at the challenges that are so pervasive when it comes to the use of technology among nurses and midwives in Ghana. So the course content is a replica of what? The course objectives. So I'm not going to repeat this one. Now, in terms of grading students, this is how we're going to do the grading. Of course, you know, continuous assessment carries 30 marks. And these are what make up the continuous assessment. You'll be assessed on assignment, quizzes, presentations, review of concept papers, and of course, mid-semester exams. That will cater for the 30%. Then end of semester exams will also go for 70%. So you need to make sure that you work very hard for you to be able to get the required grade and then end of semester examination score. So take note of that. And then again, let me also, I'm not saying I'm cautioning you, but I'm just trying to encourage you to let's have civility on our platform here. You have joined this meeting for a purpose. So if you come and then you want to disturb us, I beg to say that I'll also disturb you by removing you. So kindly bear with me and let's all have, some decorum on our platform. Okay, is there anything somebody want to say before introduction to nursing and midwifery informatics? That is considering the first one. Is there anything somebody want to say?
Good morning, sir.
Yeah, good morning.
The end of SEM and the mid-SEM, is it all objectives or there is a theory attached to it? Thank you.
Okay, so the end of semester exam, because of where most of you are coming from, you are scattered across, the country. So because most of our engagement are held virtually, I think it would be more ideal if you consider multiple choice questions. Because on the system, there has not been a deliberate, we don't even have that, having a deliberate set of questions that are written ones. The system doesn't, handle something like that. So what we do is go by the multiple choice questions, right? That is what you prefer, I know. That's why you are asking. But with this, students don't even have to ask. All that you're supposed to do is that you are supposed to learn, whether written or objective, you are supposed to read. I hope you're okay.
Yes, sir.
Okay. So now let's go straight to the substantive matter for today. Okay. Yeah, I think, please let me hear you. Hello.
Hi,
Hello.
sir.
Yeah,
Hi,
somebody
sir.
to talk. So let me hear the person.
Hi.
Yeah, go ahead with your submission. Okay, so if you don't have anything to say, then let me go straight. Now we are looking at introduction to nursing and midwifery informatics. You know, the healthcare environment is rapidly evolving, with nursing playing a central role in these changes. Now, before I introduce you to this one, let me just make some points very clear. We are going to lay firm foundation. So if you are not here with us, it will be quite difficult for you to go along with us. Now we are because of, something we term as health delivery theories. There have been a number of authors, scholars, or theorists who have contributed to the field of what? Healthcare or healthcare delivery generally. But those earlier propositions they made, it was more focused on issues pertaining to consultation, diagnosis, prescriptions, treatment plannings, among others. Others also look at something like donor-obedient theory or model. They were just trying to look at what? The processes, the structures, and healthcare outcomes. Then I said that system theory was more focused on prescription, diagnosis, looking extensively at treatment planning, consultation, among others. But all those, earlier contributions that they made, they were devoid of applications of technology in healthcare delivery generally. So there was a missing link. That was why, at first, nursing and midwifery were considered as what? An art. But with the advent of technology, it has made it more of what? Science. So these are the dynamics shaping healthcare delivery. Now, where we are trying to advance the course of healthcare delivery through the applications of what? Technology. So the gap that was lacking in the earliest, proposition by some theories or authors. Now it is evidently clear that without technology, it will be difficult for us to better manage our patient. And that is where, this is where we find ourselves. Okay, the healthcare environment is rapidly evolving, with nursing playing a central role in these changes. Nurses are required to deliver safe and competent care in the digital and technology-driven world. So we are just trying to look at technology-driven applications to complement the effort of what? Nurses and midwife. Now, modern nursing put together high-tech tools with high touch, improving patient outcomes. Nurses and midwife are the major key actors in the healthcare delivery system, transforming raw data into valuable insight for better decision making. Embracing innovative methods and technologies are essential to make their contributions and role more clear and visible to interested parties and the patient at large. Now, nursing informatics is a powerful tool that showcases how nursing positively impacts healthcare outcomes. It is a distinct specialty that integrates nursing science with information and analytical sciences. So the focus here is managing and using health information, including data that is collected by nurses and that is also expended by what? Nurses. We are also looking at data about nursing activities and resources. So the resources that are made available to nurses and midwives for them to be able to execute their tasks. And you also look at the activities nurses perform when relying on technology to drive healthcare outcomes. The purpose is to support nurses, patients, healthcare teams, and stakeholders in decision-making across the various roles and settings. So we can have what? The key players or actors in nursing informatics. A central focus is on the nurses, the patient, the stakeholders who are the government and other public health institutions. So the goal is to achieve better healthcare outcomes by effectively utilizing data, information, knowledge, and wisdom in nursing practice. So the purpose here is what has been defined and legitimized by American Nurses Association and the American Medical Informatics Association. So we are going to look at, the perspective they share to deepen our understanding or laying the foundation for where we find ourselves. Now, if you look at the three oval shapes you see here, we are looking at the intersection of computer science, nursing science, information science, as they all revolve around nursing informatics. It means that these are the key pillars of understanding nursing informatics. So those of you who have some notion that once we talk about nursing informatics, the emphasis is just on only computers. it is entirely not right. So by the end of this session or by the end of the semester, you should be able to understand that computer science is not a standalone discipline in terms of what? Informatics. But those computer field or science, we are just trying to incorporate the tools that are used in informatics to deepen our understanding of what activities nurses perform through the applications of what technology. Nurses also thrive in their use of what data and information, and that is the field of what information science. So we are also going to look at data. We are going to look at information and knowledge as they define what make up the information science. And of course, you also bring your expertise in nursing and midwifery to harness the full potential of technology. So these are the baseline for understanding nursing and midwifery informatics, especially as far as the semester is concerned. Now, the American Nurses Association has refined the definitions of nursing informatics over time. When you are talking about this refinement, what we mean here is that there has been a lot of contribution by some scholars. So, for instance, Patricia Benner, one way or the other, also contributed to the field of what? Informatics. They rely on some proposition by Stages and Bagley Thompson, where they look at what? The application of data, information, and knowledge, that they are the key pillars of nursing communication. And it was later adapted by Patricia Benner to deepen our understanding of what? Information science in the field of what? Nursing. So the ANA review all the earlier propositions and they refine those ones to define nursing informatics as a specialty that integrates nursing science, computer science, and information science to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. So this definition legitimizes the field of what? Nursing informatics. And that is the accepted or the standard definition. So let's look at the key points from the definition. We know the intersection of what? Computer science, information science, and nursing science. Then nurses thrive in their ability to use what? Data, information, and knowledge. So these are the major pillars of what? The definition of nursing informatics. So aside all the key pillars, it is also very important that you also back it with what? The wisdom that you have. All of us, one way or the other, have been trained to do certain things. But it is also very important that in the discharge of your duties, you also apply what? Wisdom. Another accepted definition was also proposed by American Medical Informatics Association, where they were explicit in their definition by saying that it is an integration of nursing knowledge and information management with communication technologies to improve healthcare globally. So the implication of this definition is that the applications of technology in healthcare delivery should not cause any harm or injury to any patient, but it is meant for the welfare of what? Communities and countries worldwide. So these are the accepted or the standard definition. Going forward with our discourses or conversation. So any of them that side so well with you, you can pick them, right? Okay. Now, nursing informatics support consumers, patients, nurses, and healthcare providers in decision-making across all spheres of what? Healthcare delivery or across diverse roles of nurses in informatics. This is achieved through the effective use of information structures, processes, and technology. So we are looking at what? Information science, and we are also looking at what? Technology to deepen our understanding of what? The activities nurses perform, right? So these are the typical examples of how technology is revolutionizing the healthcare space. So we are just moving away from the traditional paper-based system to a more robust system that is a more improved system over what we are used to. Now, before we go to information science, let me just pause here whether somebody has a question or any contribution to bring on board for us to look at it before I proceed to information science proper. Hello. Should I progress from here?
Yes, sir.
Okay, good. If I'm going fast,
Yeah.
you also let me.
Hi.
Yeah, hello. If I'm going very fast, you also alert me so that I slow down.
Yes, sir.
Yes.
Now, let's look at information science. I think I've already given a hint about information science, but we are further going to look at what really constitutes information science. Information science focuses on the effective collection, the storage, retrieval, and use of information and knowledge. It integrates aspects of computer science, cognitive science, looking at human abilities to support decision-making process, social science, communication, and library science to manage and utilize information through various technologies and services. Initially a sub-discipline of computer science, it has now fully emerged into a distinct specialty or discipline on its own. So the point here is that information science is a subset of what? Computer science. So it emerged from the field of what? Computer science. Giving attention to how we can collect data, we can store data, we can retrieve data, and we can also use or share what? Information among care providers. In the same vein, artificial intelligence has also been a key pillar of what? Computer science, but it is also moving into a standalone specialty, like the detachment of what? Information science from what? Computer science. The field is so broad, and that is why they are going into standalone disciplines. Now, let me also bring this conversation to all of you. Those of you who are using the LEMS, and those of you who are deepening our understanding of what we mean by information science. So I have defined some key terms, or maybe some key umbrella terms in nursing informatics. So let me just ask you, how do we collect data? Using electronic health records or any technology? How do we advance data collection through technology? How do we store patient information using the computer or technology? How do we also retrieve patient information? How do we share information among care providers? And how do we also present information among what? Team members. So we are going to start with the data collection. How do we use technology or computer to collect patient data? We are laying foundation for understanding what lies ahead of us. So you are invited into the conversation. Tell us something about how you do data collection in your various facilities. Time is not on our side. I'll end our meeting by 8:45. So please, we have an hour more to go. Please, are you with me?
Yes, sir.
Okay, now let me go to Precious. Jesus Sita. Wow, what's the name? Jesus.
Sir, please, we collect
Please,
data by asking the patient and also through examinations and vital signs checking. That's how we collect data. So it's either a
how does it
subjective
interface with
data or
how does it interface with technology?
sir, but we recording it on the system that we have been given.
Okay, I'm getting your point. You are talking about how does it affect or interact with our computerization. If you are not using electronic health record system or technology of that sort, it is clearly understood. But if you are using it, how does it interact with what? Computers.
So through
Let me try.
you document it on the system.
You make it on the system. How do you make it on the
Yes.
system? So can you break it
For
down?
example, if you have been given a system like the LIMS or the OASIS to work with, if the clients come, you register the clients on the system. When the person goes to the records department, they register the person on the system. Then everything you do for the client, you open the clients, like they create folders and for the client on the system. So everything you do for the client, you record it on that particular folder on the system.
Okay. 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 That's a point well made. Can we also get, thank you, Precious. Can we also get one or two other viewpoints? Then we move on from here.
Sir, please, this is Belinda.
Okay.
Sir, please, we use machineries for our examination, especially when you go to the lab. It's machines that are being used there. And then in our scan taking and X-ray, there are machineries we use in taking informations.
Okay. So with regards to what you are just saying, we are looking at the services nurses or midwife perform using technology.
Sir, the scan.
Yeah, the scan, do you do the scan by yourself or it is done at the X-ray department?
Sometimes we midwives take it ourselves.
Does it interface with the computers that you have or the system that you have?
Not really. It
Yeah,
has it.
So if it has not been fully integrated into electronic health records, whereby you can do the, radiologic services, then I think it will be a bit of diversion. Are you getting the conversation?
Yes,
But
please.
we are looking at what the major activities nurses perform using the computers or the technology. And I'm asking you, how do you collect patient information? So let's just narrow the conversation to the things we do as midwives. Okay, I understand that it's part of maybe your domain, but it is not an integral part of what your field. So let's narrow the conversation to how we go by data collection using computers. Those who are using the paper-based system, they will say that they do records keeping via patient folder or nurse's note. That is a means of what data collection. But I want you to speak to what how it is interfaced with what computers. I hope I'm making myself clear to you. Please, are you with me? Okay, Belinda.
Yes, sir, we are with you.
Okay, Belinda, let's go again. In a class of almost 600, you can remain silent just in proceedings like that.
Sir, please, I don't seem to get what you are saying. With the scan being not integrated on our computer system, because at where I'm working, we have it.
Now,
Please, it's like
the point you are making. What I'm trying to say, let's narrow the conversation. If you go into scanning, I think it will divert the discussion a bit. Let's look at a simple way of collecting information from patients via our systems.
Okay.
I hope I'm making myself clear to you.
So on the system, we have on the system,
please, we have something like e-trackers, like in the chips like this. When we see the adolescents, we have e-trackers that we use to take information from them.
Okay. Now, because of time, let me see. You see somebody.
Sir, please let me try.
Okay, Mabel. Okay, let's get
Bless. So, sir, for my facility like this, when they come, assuming that they are able, we take their ANC books, and then we have various pages that we can equally take open and then get information. But some that we are not all that clear, we go doing verbal again, like the number of pregnancy, the number of children they have. Then on the system, we have something called admission folder. Then the admission folder too, they've designed it in a way that the information that the system needs, so that it becomes a handing over tools, so that when you are not even there, your friend can actually even open the system without even calling you back. But the ones that are in the book, if you are not clear on it, then you ask the patient, please, do you get it? That's how my facility operates. So the system also becomes a handing over tools for us. Whilst even when you are not there, your friend can equally read and then take the other necessary information. Even in terms of serving medication, sometimes we know that the charts that we use to serve medication, we have 2 a.m., 6 a.m., and then 10 a.m. Likewise in the evening too. But sometimes at the time that patient comes to the hospital, the medication can equally be served maybe 3. So when you are not there, you chat the actual time. Then your friends continue. If it is 8 hourly and you chat at 3 p.m., meaning the next one will be 11. So that's how the system help us to go easily without even you calling a friend or not. And aside that, maybe your friend doesn't even input or document what she has done, you can equally go to the patient and then clarify things too as well. That's how the system actually is helping. Thank you.
A very good submission. Good one. Let me go to the last person. Liana.
Okay.
Yeah.
Okay.
Let's
Thank you, sir. I'm Liana. Nurses also collect their data through the history and the physical examination we do. The system allows us to input such information. When you take a client's history, you input it into the system. And also through the laboratory results. Clients come, we let them go to the lab. And so the results that come, you also get your data from there. Also, we get our data through the X-ray. We ask the clients to go for X-ray. Then they go, whatever they come with, that is where we get our data from. I think that is what I also have. Thank you.
But basically, what I wanted to hear is that the first point of call is the records department.
Okay.
So they take the records or the information from the patient, right? And that information is also extended to what? Other departments. So I'm looking at what? Registration. Registration as a means of what? Data collection. When they register the patient, because we have something called the OPD number or the master patient index, it represents the core of the electronic health records. So that is why you can see information from what? One end to the other. So I'm looking at how we pick demographic information from our patient, right? We collect what? Data from them. And those data, because we rely on the OPD number that is linked to or that is centralized, it makes information available to all care providers. And that is the data collection aspect I'm looking for. All other ones are very important, but they are advanced forms of what? Doing data collection. Okay, so we wanted to just narrow the conversation to the initial stages of what? Registering patient or getting patient enrolled Okay. Okay. Now, data collection is very important. When you're talking about research, it is also a different thing altogether. But let's limit the conversation to our daily routines. Then storage of what? Information. How do we also store patient information using the same medium? How is patient information stored and retrieved? So we are picking two things at a go. Talk about storage of information and retrieval of information. Now let me go to Benis.
Hello, sir.
Yeah, Benis. I can hear you.
Yes. Please, as my other colleague mentioned earlier on, in the rural areas, we are the chip zones. They've introduced a new electoral system called e-tracking. So when they come, we don't have records in our facilities. We ourselves take their history. So when they come, we use either their insurance. If they don't have an insurance card, we take history from them and we register them ourselves. So after that, we save the details. And after registering, you generate a secret code for them. So with that, even if they go to a different chip compound that is using that same system, the e-tracker system, they are able to key in that code. And when they key in that code, they are able to get the information that was registered at the other end, the other chip compound. So after registering the person, when you save the information, another chip compound in a different region can access it using that secret code you generated when you registered the client. Thank you very much.
And how we can also retrieve information. So the point here is that electronic terms, we say master patient index. It represents the core of the electronic health records. So when the patient go to any department and they query or log in with enter the patient OPD number, straight away, it takes us to the patient records. And that is how patient information is retrieved, because you enter the OPD number and that gives you an access to the patient records. Who is that? I'm just looking for that person to just remove him. Is that Rose? Rose, you are on. Okay. Now, so I was just talking about how patient information is retrieved. Then once you also enter any relevant information, you also have to make sure that you save the patient information. If it is not saved and you have erratic power supply, it means that you lose the patient information, or those information you have already entered will disappear. So you save it and then you progress to the next stage. Then let's now talk about the last one, which may be about the sharing of information. How do we communicate information among ourselves as care providers? We are talking about electronic health records. So how do we facilitate communication among care providers using computers or technology? Now let me take your views. I need about 2 or 3 students to speak to this.
So say, when our colleagues come, they can equally access the patient's information on the system regarding the previous information that you have gathered down when the patient arrived at the hospital, please. Any past history, whether the patient have been there before, or maybe it was on admission, discharged, and came back to the hospital again. So when your other colleague comes to the hospital, all you have to do is to log in into the patient's information, and it serves as a way of communicating to each other too. Thank you.
Let's hear from maybe one person more.
Say,
Okay. Yeah.
please,
It's just documenting it as in key it in the nurse's notes so that when the next person come, he or she will open the nurse's notes and get to know whatever you entered there, whatever attendance you gave to the person, everything that you keyed in will be seen there when the person log in her password. Thank you.
Among yourself. Okay, now let's look at something here. We are looking at how we can facilitate the sharing or exchange of information among care providers. Before we can understand how information is shared among care providers, we need to understand these major, pillars that define communication. We talk about system integration or data integration. Now, that is why I spoke about the core of the EHR being the OPD number or the master patient index. It is now centralized, and that brings on board all user departments. So we just want to look at how we can communicate from consulting room to, let's say, laboratory, X-ray department, pharmacy, among others. Now, the system integration is what we are looking at, how we can migrate all relevant nursing information to one centralized system so that we can rely on that to support communication. But before we can have that effective communication, we have to understand what we term as interoperability. Interoperability defines how messages are understood. So if we want to break down the conversation of interoperability, then we can also look at what? The processes that are involved in communication, the technical aspect of what? Communication. Then semantic. Semantic means how messages are understood. So these are what defines interoperability and what constitutes, the sharing of what information. Now, let me narrow the conversation down. You wake up in the morning to see WhatsApp messages on your phone. You are able to understand the message that you have received. You are able to retain the information on your phone. And you are also able to give feedback. The processes involved in those exchanges are what we term as interoperability. You are able to send mobile money, from one phone to what? Another phone, another device as well. Those processes that facilitate the exchanges are backed by interoperability. So when we get to electronic health records, we are going to further deepen our understanding of what we mean by system integration and interoperability. These are the channels of communication. So if you don't do the migration very well or the integration processes very well, then it will be difficult for communication to be established among care providers. So these are the processes, because from the conversation, from what Precious said, meaning that once you hand over to another person, the person will just come and then see whatever has been done and continue from there. That one may not be a form of what? Communication. But we are looking at communication from what? One department to what? Another department. And that is typically aided by the concept of what? Interoperability. Okay. Now, the last one, presentation of information. How is patient information presented to us using electronic health records? So that one too, somebody should talk about that. How is patient information presented to us? How is the slides presented to you? Now tell me. Presentation of information. So presentation of information, a class of almost 600 students. I like.
Sir, please, is true written?
Yeah, hello. Okay, so
Yeah,
we are
the
looking at
information are being documented on the system. So when you open the patient's folder, you are able to get whatever you need there.
okay. So how the information is seen on the computer system, that depicts presentation of what? Information. I hope that is your view, right?
Yes, please.
Okay, I think it's a point well noted. Now let me go to Debbie. Deborah.
Quiet, I'm not talking. Thank you, sir. Please, the information is being written like the name of the client is being the age, the community, the condition the person presented, how it was managed. I think that's my idea for this.
Okay, that's a very good one. Now let's look at how information is presented to us. Those of you who are still relying on folders, nurses notes, this is how information is presented to you. Your role is to pick the patient folder. Once you open the folder and you have access to the patient records, it is a way information has been presented to you because you can see and make sense of what? The content. But whenever we want to align the conversation to electronic systems, like I have just shared my slides with you, the information has been presented to you because you can see clearly what I'm talking about. So in the same vein, once you enter the patient OPD number and you have access to the patient records, it means that the information has been presented to you because you can make sense of what you are seeing. And that is how information is presented to us. Okay, now let's head forward.
This reminds me of another kitty who had trouble training and thought about giving up, but her friends cheered her.
Hello. Advise yourself before I take you away. Okay. Now let's go to types of clinical information systems. Now we are speaking about information science. We have also spoken about information systems. But let me also chip in something on information systems. Now, if you go to, those people doing computer science, they have a course in information systems, or information system is even a distinct specialty on its own. It has been detached from what? Computer science. So that one seeks to look at the utilization of what? Technology in business organizations or within organizations. So information systems and then informatics. Informatics is more broader because it encompasses almost all disciplines. But information system is just limited to the applications of technology in organizations. So these are the differences, right? So in examination, sometimes you can see a question, so the student should be able to align to a particular question or statement. So you can have a question that may require you to informatics, it defines nursing informatics, it defines information system, among others. Then you also have clinical, you get there and then you get confused. Now the types of clinical information systems. Clinical information systems are designed to support healthcare providers in managing patient information and clinical workflows. So we are just looking at how we can facilitate the activities nurses perform. So the key types include electronic health records, which is a digital version of the sometimes I don't know whether you wonder the things you say or you do, the feedback comes to all of us. It's well. Okay. Now, electronic health records, like I said, that it is a digital version of the patient paper chart, or it is a systemized collection of patient and population stored health information in a digital format. So we are just trying to personalize what? Healthcare. That is why we have for patient portal, right? That may come with what? The patient history, diagnosis, treatment planning, laboratory results, medication information. All these are the components of electronic health records, or what defines electronic health records. The next one is what? Laboratory information system. They are used to manage laboratory data and processes, including sample tracking, test ordering, and results reporting. So the clinician at his or her end may request laboratory services, X-ray services for the patient, right? Then in the same vein, those laboratory attendants will also forward the results to the sender. Now, radiology information system is a specialized system for managing radiologic images. So we can talk about magnetic resonance imaging, MRI, then we can talk about computer tomography, CT scan, among others, for the purpose of appointment, the storage of image, and reporting results. These are aided by what we term as picture archiving and communication systems. So traditional system of radiology was not more clear or was more difficult for clinicians to had considered the right interpretations of what? Those radiologic images. But with the advent of what? Advanced form of technology or software like the picture archiving and communication systems, it becomes so easy for clinicians to give the right interpretation to those radiologic images, especially for inexperienced clinicians. So it is also a type of what? Clinical information system. Then we also go to pharmacy information systems. They are tailored around the activities pharmacy people perform, including medication management, inventory control, prescriptions, and then dispensing of what? Drugs. Now, we are just coming to nursing informatics. So nursing information systems are tools to support nursing workflows, including documentation, patient care planning, and medication administration. So these are part of the activities nurses perform when managing their patient. And all of them have been interfaced on the electronic health records. Decision support system. They provide real-time alerts, reminders, and evidence-based recommendations to assist healthcare providers in clinical decision making. So when you go to decision support, which is also a major part of the topics under consideration, I will ask you a number of questions because I'm interested in the topic. I just want to find out from you whether with the introduction of what? Electronic health records, it comes with what? Some reminders or alerting systems that ensure that even if clinicians are not making the right decision or call, they are alerted by the system to make the right changes that may go on to improve healthcare outcomes. Because if errors go undetected, the patient will suffer. So the advanced electronic health records should have what? Decision support system embedded onto the system so that it can also be an anchor to the provider to limit the rate of what? Errors that may occur as a result of what? Documentation or other decision making. Then patient monitoring system, real-time system used to monitor patient vitals. So we are looking at such as heart rate, blood pressure, oxygen levels. They are integrated with the bedside devices. So we are looking at something like look at electrocardiogram, something to monitor the electrical activities of what? The heart. Then we go to telemedicine. Telemedicine systems. They are platforms that enable remote patient care through video consultation, remote monitoring, and secure communication channels. So the conversation here is just about telehealth, telemedicine, telenursing, teledentistry, telerobotics. All of them are the ambit of, telehealth. It falls within telehealth. So the telemedicine is just a platform extended to those people who are in disadvantaged communities who may not have direct access to physical medical care. So we can perform video consultation, audio, services, audio consultation, and we can equally ensure that these people who live in sparsely populated areas may also have what? Access to healthcare. You know, if you go to India, their population have now even overtaken those of the Chinese. And because of a lot of rural communities they have extended some of these telemedicine applications so that those people who may not be able to access services being enjoyed by those in urban areas, in order to have fair distribution of health resources, they have also extended technology to wherever they are so that they can equally have what? Online consultation or other virtual means of what? Accessing healthcare. We'll talk about telemedicine as part of our topics, and you understand this better. Then we have surgical and then anesthesia information systems. They are used in operating rooms to manage surgical appointments, documentation, and then anesthesia records. Emergency department information systems are also tailored for emergency care, providing tools for triaging, patient tracking, and other management. Then the last one about the clinical information system is what? Population health management systems, which look to analyze healthcare outcomes and managing patient population to improve healthcare. Right? So these are the available clinical information systems. We can also narrow the conversation down to these areas. We can also classify them as what? Ambulatory clinical information systems. So we are looking at maybe the services that occur at the OPD. Then we can equally look at what? Inpatient information systems. Either we are talking about oncology, we are talking about the specialty areas. All of them are also, all of them also rely on advanced form of technology. Then we can also talk about ancillary information system. When I talk about the ancillary information system, we can talk about those departments that play supportive services, like the laboratory department, the X-ray department, the pharmacy department, and those people who are not into the clinical services, they are considered as what? Ancillary, right? These are the things I can talk about as far as clinical information systems are concerned. Now let's talk about why nursing informatics. Why nursing informatics? It provides nursing perspective. It provides nursing perspective. It means that it reflects the views of what? Nurses, because they understand the essence of what? Technology, and therefore whatever we do reflects the ideology or the viewpoints in the field of what? Nursing and the midwifery. It also illuminates nursing values and what? Beliefs. These beliefs and values have been there from day one. Nightingale from day one even made an attempt to see how best they will use an efficient system to organize nursing information system, because they noticed information was becoming too voluminous and it was becoming something like a workload. So they needed to use an efficient system to organize nursing information. Share the values chart. Please explain the chart for us. And then it also denotes a practice base for nurses in health informatics. So the American Nursing Association, they legitimize the field of what? Nursing informatics. So it is now a clear path for all of us to practice. So it denotes hepatitis B for nurses. That is what we are witnessing this morning. It produces what? Unique knowledge. Once you adopt technology as part of your interventions, then it makes your role more unique, right? So that somebody may say uniquely brings on board that uniqueness. Oh, let me. The moment I decide to remove them, then they are saying I should temper mercy with justice. Okay. Distinguishes group of practitioners. So this one also set us apart from what other practitioners. So we have legitimized the field of what? Nursing informatics. And I don't know what other fields are also doing, even though I know the laboratory, those in other disciplines, but it has now been made more clear, especially in the field of what? Nursing. It focuses on phenomena of interest for nursing. It is also a field that is interest for practitioners in nursing. It provides the needed nursing language and word context. We are talking about uniformity of language. So the conversation we are having this morning, it is not, but all of us are seeing this pivotal role technology brings on board. That is why all of us have joined. So it provides that uniformity of language wherever you find yourself, your patient. Now let's go to the tools. Healthcare informatics tools. Now, let me just hide this information from you. What do you think about it? What tools do you work as nurses in informatics? So please, bring out your views on that. What tools do nurses in informatics work with? What are the tools you are working with? Please, are you following the proceedings?
Yes, sir.
Sir.
So I'm asking you, okay, now let me go to Esther.
Sir, please, we use computers.
Okay, then what again? Just be mentioning them and then let's move on. Time is not on our side. We have about 10 minutes more to go. Please.
Tablets. We use
Tablets.
Okay, we have tablets.
New
What again?
BP apparatus.
BP apparatus.
Yes, please.
BP apparatus.
Thermometers.
Even though you see, those are the tools we are working with. There are some form of technology, but we are limiting the conversation to, I mean, what is interface with what? Computers. All the activities you perform using computers and other forms of what? Communication. So if you don't take care, then all the accoutrements that are used in the hospitals will be brought to fore with the conversation. So let's limit it to the things that we do. I mean, relying on the computers and some few things. Okay. I hope you are getting the conversation.
Yes.
Yes, please.
Okay.
Phones.
Now, okay. Somebody want to talk, right? Okay, now let me go to you. So these are the healthcare informatics tools or tools in nursing informatics. The first one is what? Clinical guidelines. They are evidence-based protocols guiding nursing care. Clinical guidelines. Somebody may ask, why is clinical guidelines seen as what? A tool. You will see, before the advent of what? Computers or technology in healthcare, we were relying on standard treatment guidelines that was designed and made available to us by the Ghana Health Service. You go to the pharmacy department, they also rely on what? BNF. And it happens across all other departments. But with the introduction of computations in healthcare delivery, they have migrated those guidelines to affect computerization. That is why all relevant nursing informations are on the computer systems. And those serve as the clinical guidelines. They are there to complement what the things we do. Without that, we can't do anything. Computers do not work in isolation. They work in synergy with what? Software. Okay? So the guideline has been transformed into a software that is being able to interface with what? Computerization, so that it can assist us in decision making. Then we have formal medical terminologies. We are looking at a way of communication. So the vocabularies are some languages. So in our computer system, or on the computer system, we try to see how we can have a shorthand form of what? Communicating information among care providers. So when we go to taxonomies and the informatics system, we will just deepen our understanding of what? Medical terminologies. So we can have what? International classification of what? Diseases, just to make communication very easy among care providers. Then computers, of course. And then information and communication systems. Any form of technology that support communication among nurses are also seen as what? An integral part of what? Informatics tools. So for instance, mobile phones, all of them are ways in which we can communicate or exchange information. So these are the major tools that you can find in nursing informatics. Let's now narrow the conversation down to technologies that have evolved or emerged due to healthcare or nursing informatics. So these are distinct from what? The major tools I've mentioned. These traditionally have been with us, but we are now looking at the emerging technology that has found its way in the healthcare. So, for instance, we have computerized provider order entry. It streamlines orders for medications, alerts, and then treatment. In simple terms, this is a system designed to assist clinicians for them to have what? Direct engagement with what? Patient and other care providers. So in the consulting room, the clinician can request laboratory services on behalf of what? A patient. The clinician cannot communicate to other care providers. So these are what defines computerized provider order entry. Then we have what? Electronic health records. I have already given a hint about electronic health records, but these are some of the things that are also associated with electronic health records. We can have for test results. We can have for progress notes. We can have for nurses notes. They are all digital platforms that are part of what? Electronic health records, medication records. Then we move on to referral trackers. So we monitor and then manage patient referral across healthcare providers. But at the moment, the system that we have, they are facility-based electronic health records. It doesn't transcend borders. When I say it doesn't transcend borders, it means that you are unable to refer cases beyond where we are. Now, Ghana Health Service, we are doing some piloting studies in Central region and then I think in Savannah region to see how best they will centralize all, healthcare facilities to become part of what? One centralized system. So that whenever I want to refer cases, it will be very easy because all of us will be relying on what? One system. So we have what? Referral trackers that can ensure that we are able to monitor and track what? Refer cases. Patient portal. It allows patients to have access to his or her own records. Just as you have student portal that enables you to have access to your examination results or any other relevant information, in the same vein, patients should also have their own portal. Even though the portal they have now, it is not interactive because it doesn't allow them to also engage care providers. We use the portals or the platform to manage them. But advanced electronic health records should give room for patients to also be part of what? Healthcare delivery. So we are going to make it more personalized so that the patient will also be integral part of what? Healthcare delivery. Then blockchain technology in healthcare delivery. The blockchain serve as what? Platform to ensure that patient information remain well protected and secured from cybersecurity threat from people who are not authorized to have access to patient records. When you go to we go to security, ethics, and then how best we can provide the needed security protocols to safeguard patient-sensitive information. We will talk about that. Then telenursing, telemedicine, I've already spoken about this. Then artificial intelligence. We all know the significant evolution or impact artificial intelligence is finding its way, especially in the healthcare space. We can talk about different areas of what artificial intelligence, where we can talk about deep learning algorithms. We can talk about natural language processing. Artificial intelligence, this is how it works. Though we have critics who may have issues with the use of what artificial intelligence, because artificial intelligence, one way or the other, may create some kind of what confusion. But artificial intelligence can write better than we do, can even think faster than we do. It is up to we, the individual, to ensure that what the artificial intelligence system provide to us, we scrutinize them and apply them for our own benefits. Now, artificial intelligence rely on what? So many literature databases. So many literature databases. So we train those models, and those models are trained on various databases. So as soon as you enter information, then you get feedback from what? The AI. You will not get any information from the AI. So we want to ensure this so that we can have what evidence-based interventions that may support what decision making. So AI, even though it has its own challenges, like issues of trustworthiness, issues of what transparency, among others, but it is also advancing the course of what healthcare delivery. You can't doubt that. Machine learning, which is also part of what artificial intelligence. Artificial intelligence has been born out of what machine learning. It is also meant to improve predictions, diagnosis, and patient care outcomes. So we need some of these emerging technology to support decision-making process. Now, the goals of nursing informatics. According to the Center for National Research, the National Center for Nursing Research, they have outlined 6 primary goals for nursing informatics research in computerized documentation. So, and that is why NMC has a need to make sure that all practicing nurses will do nursing informatics to have that required competencies. Then develop methods to build clinical information databases. All the services we give to our patients are backed by a centralized system. That is the database infrastructure that support decision making. We want to determine how nurses give patient care using data, information, and the knowledge. These define the key pillars of nursing communication. And we want to develop and test patient care decision support. I've already explained decision support. Then develop workstations that provide nurses with the needed information. So the workstations are specialized computer systems that are meant for technical and scientific purposes. So it is more similar to that of what databases, right? But it's just a specialized computer system that is placed at a vantage point and become the source of what information flow for nurses to rely on. Then develop methods to evaluate nursing information systems. So there should be a way to do evaluation to see whether we have made some steady progress or whether we are not making any progress. So evaluation is very important. Now, any question? as we wrap up, any question from anyone? Any question? Please, any question? Please, I'm asking you any question.
No, sir.
Hey, so you're okay with
please.
the plenty talk?
Yeah, okay.
Now, give me your views about the benefits of nursing informatics. You are working with what? We are wrapping up on this one. You are working with, some of the tools that we have mentioned. What are some of the benefits from the use of such systems? So recount to me how nursing are impacting the course of healthcare delivery. So please bring out your views.
Sir, please, it has saved a lot of time.
It is faster and transparent.
It has improved on our accuracy in our field of work.
So it helps us retrieve patient information easily.
It has reduced medical errors.
It has limited the rate of what? Documentation. Everything is now. It limits the rate of what? Data entry error. This is what I mean.
Sir, please, we can't hear you.
All of the benefits. What are the benefits? Hello. Please, I'm asking, or it's okay. Okay. It's okay. I've seen that somebody
Please,
said that
your
it's
line
working.
keeps fluctuating, so we can hardly hear you.
Is it okay now?
Yes, please.
Yes, please.
So somebody has indicated that it makes work easier. It helps to retrieve patient information. It makes work faster. It prevents loss of information, and it saves time.
And it has created a lot of space at the record departments.
Okay, lot of space at the record department.
Lot of space at the record. So it has also saved money.
Okay. So
In terms of printing of nurses' notes and then TPR charts and then folders, it has also saved money.
Okay. You see, some people are looking for offices, to occupy. Then we keep folders in even 2 rooms in the hospital, just folders. So it has made the record department more spacious. Okay. Now let's review what I have here. It improved patient care, or there's a more improved patient care. It has also enhanced communication among care providers. It has also increased efficiency in clinical workflows. You know, the people-based system has been characterized by inefficiencies, but the applications of technology or electronic health records addresses some of these inefficiencies, make better decisions through data access, reduction in medication errors, streamline documentation and records keeping. It facilitates evidence-based practice. It also supports patient-centered care. It also enhances data security and privacy, and it improves outcomes through predictive analytics. A host of them. There are so many positive impact we can talk about. So you can even consider more. You can even add more to what I have just indicated. So your assignment is, this is not a written assignment, but just go and look for some of the challenges. So that one will be the thing we consider first before maybe our next topic. So look for the disadvantages of electronic health. Look at the challenges you are facing in the use of such systems, and come and tell us, God willing, next week. Any question before we end our meeting? We are supposed to end at 9, but kindly permit me to end the show for today. End the show for today.
Sir, so please, the reading assignment again, please.
I'm saying that just look at your environment where you are using electronic health records. What are some of the challenges that one way or the other is hampering the full progress of what? Workflow among what nurses. So look at the challenges you are facing in the use of what such systems, and come and tell me next week, right?
Thank you, sir.
Should I even forget? Please just remind me so that we review the disadvantages, right? Okay. So any question before I go?
The question again.
I'm saying that any question before I go? Okay. So in the absence of questions, and then let's say contributions, I beg you that discharge me so that we continue next week. So thank you all for coming. I think we have had a very impactful conversation. So I would just also encourage you to also start reading. I'll make all the resources. So enjoy the rest of your day. All the best. Bye.
Bye. Thank you, sir, for your time. Bye.
Good day.